What I want to do today is just to run through quickly in the half an hour we have is an introduction to patient portals and Manage My Health. And I want to give you some background as to why patient portals and at the same time also talk about the business case around patient portals. So I want to first take a little step back to start with somewhere we all identify with. So patient portals are primarily trying to introduce concepts of self-service, which I think all of us are in our day-to-day life have come across. So whether it's in internet banking or at the supermarket or at the airport or at the airlines. So what we're trying to do with Manage My Health Patient Portals is to try and look at how can we take certain activities, routine activities that practitioners are doing so that patients can do that work themselves. So take some of those costs out of general practice. So when we say self-service, we're not always talking about everything, so there are always limits. So there will be things that make sense to be done through a patient portal, and at the same time, there will be things that don't make absolutely any sense to do through a patient portal. So just like an airline won't let you fly their planes, same applies in anything. I want to spend a little bit of time talking about the rationale. So I think today in a face-to-face model, we got patients, reception staff, nursing, GPs with sort of reasonably clearly demarked boundaries. What we're trying to do is to push some of those boundaries such that the patients are doing some of the routine admin tasks that receptionists are doing, which will free up the reception to do some of the activities that nurses are doing, and vice versa. So if you look at some of the challenges we are facing, not just in New Zealand, globally around general practice, a shortage of doctors, and not having enough, nursing staff. Patient portals are about trying to make sure that we take away all those routine stuff out of general practice so that patients can actually do that themselves, which ultimately should lead to efficiencies for the practice, but also cost reduction for the practice in terms of cost of operating. For the patient, it's really about a better patient experience and satisfaction. What we'll do next is just go through some of the services. So I won't repeat this. So in terms of the benefits for healthcare providers, it's really around productivity improvement. It's about not just working hard, it's actually about working smarter. For consumers, it's about convenience. So basically means patients don't have to, always have to rely on telephone tagging and what have you. They can do things in their own convenience. What we'll do is we'll actually go through quickly the vision for the product, and then we'll actually go through the two experiences, one from the patient side and one from the practice side, to see how the experience looks like for various key services. So I think in terms of the vision of the product, what we're trying to do is electronically connect you and I with our respective healthcare providers. And that's really where the patient portal comes into the picture. But there are also other Manage My Health products like the shared electronic health record and shared care, which enable number 2 and number 3, which is around if you went to hospital, how does the hospital clinician have access to your health information? And in number 3, we are talking about patients with long-term conditions and multiple medical medications, etc. How do we enable a team to basically look after us from a chronic care management point of view? But today's discussion, I'm going to limit it, given the time, primarily to patient portal. So what we're trying to do is Manage My Health is about delivering integrated care for the patient. So let's have a quick look at the patient portal. In terms of the patient portal, there are a range of features that are available. One of the things I like to say up front is that don't think there's obviously a lot of discussion at the moment in the marketplace about needing to implement patient portals and what have you. I strongly encourage you to and urge you to don't think of patient portals as the destination or doing something. Think of patient portals as just a tool that you can utilize in your general practice. So, so in terms of the features, you got appointment booking, lab result notification, recalls, secure mail, repeat prescriptions, giving patients access to their health information, etc. So
one of the key things here is that it's not implementing Manage My Health. It's not about giving every patient access to all the features. It's actually about looking at how does practice utilize this tool to make your life better. That's what it's all about. So it's not about every practice should implement the patient portal the same way. Different practices can implement the patient portal in different ways. And as I go through the individual services, I'll show you and share some examples of where different practices have basically shared, done different things differently using the same tool. So let's start with the key features. So I'm going to focus purely in terms of the services around appointment booking, lab result notification for normal lab results, repeat prescriptions for meds that are long-term, recalls, and secure mail. Excuse me. So let's start with appointments for a second. So in terms of appointments, what I'm showing you here is just a quick screen of what the patient experiences with ManageMyHealth. So if I log into ManageMyHealth as a patient, basically what they have is they can book an appointment for themselves. If you are a practice with multiple locations, then you can allow the patient to select which location. And basically, any here means any doctor. So basically, the appointment slots in green here is basically when appointment slots are available in this particular Highland Special Medical Practice. Now, there's a couple of important things. You can do appointments in two modes. One is you can allow the patient to select their doctor. The second mode is you can actually ask, so if some of you only want to restrict the patient to book their appointment to the default provider, which is in the MedTech 32 F3 screen, then there's a configuration option to do that. Now, during this webinar session, I'm not going to take you through how we do a lot of the setup, because the setup is a one-time activity and it's relatively straightforward. So I'm really going to show you the service experience from a patient point of view and from a practice point of view. There's a couple of rules we implement. When you try to book an appointment, this is assuming, let's say today is Friday the 14th. The screenshot was taken last year. We only allow patients to book appointments for the next day. So what that means is that if you think of a consumer behavior or psychology of the patient trying to rush and get into an appointment in the same day, the chances are they don't do that. At the same time, we're trying to make sure we don't disrupt the workflow in the general practice by allowing same-day appointment booking. So let me give you an example. Let's say you're at a clinic today. It's now, we're doing this webinar, it's 20 to 1 o'clock. You have a clinic that opens its doors at 9 a.m. tomorrow morning. So basically, if that practice was offering the appointment booking service, patients can basically book an appointment until 8:55, 5 minutes before that clinic opens tomorrow morning. Once the clinic opens its doors, then the next available time they can book is basically from the day after that. So if anyone is in a hurry to get into an urgent appointment, they just need to ring through the telephone. What you'll find is as you implement the patient portal, most practices don't actually have appointment slots available on the same day to give, so it's about trying to shift and manage your patient demand there. Now, one of the things is there's a number of things here, just going to touch on quickly. There's a whole range of things like terms and conditions, and so what happens when a patient books an appointment, they cancel it, or if they book an appointment and they don't turn up, and all those things. We've got templates for all of those things. So those are sort of things that we will take you through. Remember what I said at the beginning, this is a tool. So the team that will, whoever's implemented will take you through to help you understand how you need to configure them. We pretty much have templates for practically everything. Now, a couple of other quick things. So basically, if I wanted to select a time slot and book an appointment, basically what happens is I will be asked to enter a reason for the appointment, a note, and that note will basically appear in the MedTech 32 appointment book as a note that the patient entered. So you'll see that in terms of the two sides, from a patient point of view and from a practice point of view, there is no manual double handling. It's all pretty much seamless. The other things that some of the creative things you can do is, I know a number of practices that, for example, have a lot, their appointment books are very busy in the morning and relatively relaxed in the afternoons. So what we've encouraged them to do is say, hey, look, why don't we offer appointment slots only in the afternoons? And what you'll find is after about 2-3 months, patients will basically adjust to their behavior. If I was a patient, put myself in those shoes, unless it was absolutely urgent and critical, if I can live with it, I'm happy to book an appointment at 2 o'clock rather than trying to squeeze something in early in the morning. Also, it frees up the time for patients to, manage their own timetable, choose a time that's flexible to them. So one of the things is that you'll see as we go through the session, the experience for the practice is always through MedTech 32 with ManageMyHealth. We don't require you to leave MedTech to do anything. So you'll find that in terms of that, it is very, very tightly integrated with your MedTech workflow. So let's look at a couple of things. How did these appointment slots turn up here? So there's a few configuration screens. So basically, all your appointment slots that are normally published in your appointment template will turn up here. You can turn off slots. There's in the MedTech 32 appointment template setup, there is an available checkbox. You can untick those so those appointments don't turn up. So what I'll do next is quickly go on to the next one, which is lab results. So again, what we're trying to do here is not to change the workflow in the practice, but to try and make it a lot more seamless and smarter. So the lab results will keep coming to your provider inboxes as it is doing today. So nothing changes there. So if you have a patient who is on ManageMyHealth, what the doctors can do and what they're doing is they're entering the doctor's comments here. Typically, they range from N for normal, normal, don't worry, or normal, but we'll do this again in another couple of weeks. And so basically, you can go and file the lab result. And as soon as you file it, what happens is the lab result is fully encrypted and securely moved to ManageMyHealth. And what happens is ManageMyHealth will send the patient an email saying that they've got a lab result. The email will not contain any clinical data, so there's no opportunity for anyone to breach the privacy or what have you. So the patient is required to log in to see that. So I've logged in as a patient here. The results are normally, new results are shown in green, and basically if I click and open it, I can see the result there. Surprisingly, the results, even though ManageMyHealth is available 24/7, a lot of the patients are still basically printing the results out. Now, there's a couple of other unique things that practices are doing with ManageMyHealth. So let's say if the result is to do with warfarin and INR results, what doctors are trying to do is to say to patients, rather than me text you or email you, I will actually write the INRs into the comments field, and that will be the method in how we will communicate with you. The main advantage of this is that if you look at text messaging or email, there's no guarantee that the message will be delivered. B, it's also not secure from a privacy point of view. Whereas with ManageMyHealth, because none of that data is going outside, there's security and privacy, but at the same time, it's also from a patient point of view, because you're required to log into the patient portal to look at it, there is also a read receipt. So if you haven't logged in and looked at your results, ManageMyHealth will do the hard yards by sending a reminder to the patient. Now, that's really for normal lab results. So let's look at what happens if, for example, a patient has a result that is got something that needs to be communicated face-to-face. Could be cancer, could be something else that's serious. So what you would do is you would mark the result as do not upload to ManageMyHealth, and then file it and ask the nurse to call the patient in for a face-to-face meeting, just like what you do today. So one of the things is that it's a good time to talk a little bit about this do not upload flag. You'll find that we have this flag pretty much everywhere in the clinical record. So it is in lab results, it's in medications, it's in consult notes. So it's pretty much everywhere. So you have the ability to withhold certain records from going to the patient. So that's pretty much, from a workflow point of view, there's no change to the workflow for the providers. So they just do that and they file it. They don't have any more chasing to do or communicating. What we've found out talking to practices is that, in reality, a lot of patients are quite anxious about their results. So what tends to happen is they will call the reception a few times before the results are ready. So this takes away all those kinds of headaches. There's also some useful links like Understanding Your Lab Results, which will take you to the Lab Test Online website that helps consumers understand their results. One of the common questions I get asked is, do patients call to find out what these individual items mean? The experience and the feedback I'm getting from a lot of the doctors is that's not the case. One of the things we monitor is that a lot of patients are actually, when they are new to ManageMyHealth, they will use these kind of links to educate themselves. Otherwise, they don't actually worry too much. They essentially follow what the doctor's comments mean. So that's really lab results. We'll then move on to the next service, which is repeat prescriptions. Again, relatively straightforward. This is a patient view. My medications that are long-term or marked long-term turn up here. The patient has a choice of selecting the script pickup method, whether the patient to collect, whether they want it to be posted in the mail or to be faxed to a pharmacy. And you can configure all of these things, so I'm not going to go into those in detail. And if you, for example, if a patient wants to request a medication that is not a long term, they can always type it in here, so that will still go to the GP. So let's have a quick look at what the repeat medication request looks like. So all these requests come into the provider inbox under the ManageMyHealth. So this, for example, this one tab means there's one unread message. So if I open that message, so this is a test patient called Charlene Abbott. It basically has a medication name, the request for the repeat. We pre-populate the screen for the user with number of additional fields like date of last invoice, last consult, last prescribed. So from a user point of view, there's only two things you can do. You can either repeat this medication, hit the green button, or you can reject it. So if you think 71 days is a long time, actually like to see you before I repeat this, please click on reject and type in a note. I like to see you before we repeat this. That'll go back to the patient. If you hit repeat, basically it has the same effect of right-clicking on the patient medications tab in your patient manager. So it's pretty much one click done. So just a couple of things on the repeat prescriptions. You can choose in your individual practices how you want to set this up. So the common setup options in the practices I see in the market is people are basically encouraged to send the repeats directly to their GPs, mainly because there's a common acceptance that when a patient rings a reception, and then the receptionist then writes it on a note to the nurse and then finally gets to the doctor. There's also a lot of transcribing errors. And also, a lot of the doctors tell me, in reality, even though the script comes to them for signing, they need to still open the patient medications, check allergies, and all of that. So it takes still the same amount of time. So you can basically make sure, so a lot of practices are more and more streamlining that process, eliminating a lot of errors and transcribing errors, and also multiple handling by just having one person deal with it. If you're a practice, on the other hand, you want to have a nurse triage all these, you can set it up as well. So there's one central nurse who's actually, or nurse or team of nurses that are actually managing the repeat prescription. So those are sort of things we will discuss with practices when we go to implement Patient Portal. So I'll quickly go through the other two services. So one is the next is recalls. So one of the things we've enabled is, most of you are already using things like SMS for your recalls. The idea here is that if the patient is on ManageMyHealth, you should use ManageMyHealth to do the recalls. There are a couple of advantages. One, it's free in terms of there's no additional cost like text SMS. But the other advantage is this is where a really good opportunity of where the ManageMyHealth online world transcends the physical world. So let me explain that. So let's say I send a recall reminder for flu vaccination. patient reads it, so it clearly says when the patient was contacted. Now, if the patient took an action like go and book an appointment, it'll write back into your MedTech 32. So whereas if you send an SMS or a letter, you still have to manually update all of this. So the general idea is that, if all your patients are on ManageMyHealth, so this field here indicates who's on ManageMyHealth, send ManageMyHealth recalls. For the ones who don't have ManageMyHealth but have a mobile phone and have given consent, send them an SMS, and for the rest you'll have to either contact them by phone or send them a letter as you would do normally. Over time, what we expect to happen is that as more and more patients are on the portal, you would be able to basically do most of your recalls online. So this is an area where there's huge savings to be achieved for the practices. So this is a quick screenshot of what the message recall reminder message is. So it just shows the read receipt for the message. So one of the big advantages is that there is read messages for all of these things. We'll go to the last service very quickly, which is secure mailing. Now, you don't have to offer secure mail, but if you want to offer secure mail, there's a number of key advantages here. When I talk to a lot of GPs, they tell me that there's a select group of patients they constantly email, and so they will use extra Gmail, Yahoo, what have you. And basically, at the end of the day, they need to copy all those emails and put it into the daily record for medical legal purposes. With ManageMyHealth, you don't have to double handle them. So if you use ManageMyHealth, it basically sends it and copies the record into the daily record. There's also a whole range of other advantages, like if you're on holiday, patients can email you on your Gmail or Yahoo accounts, and you have no idea unless you read it that these emails are coming in. And the practice is also in the dark of these emails. With ManageMyHealth, if your patients are encouraged to use ManageMyHealth secure email, and then basically when they go to email you, they will know that you're not working because your out of office is on or your on holiday message is on. So there's a whole lot of safety guards built into it. So generally, if you are a GP that's using public email, you don't have to do that anymore. You can use that. There's a dedicated icon for it. Now, apart from sending individual emails to patients, there's also group email features, so you can send all your patients on ManageMyHealth a flu vaccination notice, or you can have that segregated by. There's also ability to select by read code and what have you. So that's really a quick nutshell of ManageMyHealth. What I want to do in the next couple of minutes is just update you on a few new things that are happening. So at the moment, we're in the process of, today ManageMyHealth, we launched it in 2008. And since then, most of the patients and providers are using it. Providers are obviously using it through MedTech 32. Patients are using it through a website. Since Christmas, we've now started the beta trial of our mobile labs. So our expectation is that patients who don't have a computer at home should be able to do everything they do on the patient portal, either using an Android smartphone or an iPhone smartphone. The smartphones are also available for practice staff like reception nurses and doctors. So if, for example, if you're a doctor, you use your ManageMyHealth credentials or passport to log in, you can see your daily calendar and you can reply to secure mail and what have you. Now, what I'll do is we are running out of time, so I want to quickly step out of this for a second, and I want to play a quick video that basically, this is courtesy of Compass Health in Wellington. It explains the perspective of ManageMyHealth from a doctor and two patients who have been using ManageMyHealth for quite a long time. So I'll just put it on full screen, and I'll stay quiet.
I'm Richard Medlicott. I'm a GP here at Island Bay Medical Centre. We're quite a large practice. We've got about 11,000 patients here on the south coast of Wellington, so it's a pretty busy practice really. So ManageMyHealth is a web-based patient portal. Think of it as internet banking for your health. ManageMyHealth is a great way of patients managing their own healthcare online with up-to-date information and ability to message their doctor or nurse.
My name's Frank Meyer. I'm 72. I've been a patient of the Island Bay Medical Centre for 20 or 30 years. Richard Medlicott is my doctor, and he introduced me to ManageMyHealth about 5 or 6 years ago. He explained how to get onto it. You had to do an initial login. I regularly have blood tests, and he posts the results on ManageMyHealth, and I get an email to say there's a new message, and bingo, there it is. It's a brilliant platform. It's more than just blood test results. It has a record of medical events, so if I'm filling in any forms or applications, travel insurance for example, I can look back and say, oh, I had a heart attack 15 years ago, I had a cardiac arrest 3 years ago. It details my medical history. I can look back and see that, oh, I went for a doctor's appointment 5 weeks ago, therefore it must be about time I go again.
So Frank is a patient who's got a few health issues, and our main use of ManageMyHealth has been around managing some of his medications with results going back fairly frequently. Frank appreciates having up-to-date information. He's interested in his results. We have a good discussion when we see each other face to face, and it saves me a lot of time in terms of having to phone results and so on, and saves the nurses time as well.
I'm Jo McDonald. I live in Melrose with my husband Vito and my 4.5-year-old daughter Sophia. She goes to creche in Miramar and I work 30 hours a week in the city. ManageMyHealth is a way for me to communicate directly with my doctor. It could just be as simple as a repeat prescription on some sort of cream or ointment that we've had for Sophia, so I can simply click through to repeats and do that through ManageMyHealth. I book all of my GP appointments through ManageMyHealth. Again, it's just so easy.
I've been Jo's doctor for about 3 years or so, and I introduced her to ManageMyHealth fairly early on in our relationship, and we've used a reasonable amount since then with messages going back and forth around aspects of healthcare, which I think she's really appreciated, and it's been useful in terms of communication with a busy working mother or a busy doctor.
I can tap into it at 4 o'clock in the morning if I feel so inclined. The ManageMyHealth website is so simple to use. I enter my password and bingo, there it is. It even reduces the number of times that you have to see your GP.
I'd strongly recommend ManageMyHealth to patients and practices. Having a patient portal for information is really important for healthcare.